Hi again. We're with YT Belk, Councilman Clarkston, and I'm telling you, we're being informed today. In the beginning of our conversation off air, we were talking about people have to understand the parts of government. So could we talk just a little bit, because we hold you probably accountable for stuff the state senator do, and then the president for stuff the councilman in our office in our area should do. So just a little bit of remedial for for government, so we can begin to understand and like encourage people and incite them to go study. Well, wait, let me see who's supposed to be doing this for me, because that's going to help communities get more of what they need when we do that.
Yeah, I'll start by saying that all jurisdictions, whether state or local government or federal government, is completely different according to where you are. But what I will say in my purview as a city government, working in city government as an elected official, like, people do not show up for local elections. But let me tell you, you need to, right? The water that you drink, the trash pickup, the roads that you ride on, the businesses that you have, the grocery stores that you have in your city to meet your nutritional needs, the types of schools and the funding, your taxes, what you're getting out of it, like all those things are decided by local elected officials like myself. When it comes to the state government, those are the statewide laws that will be enacted and impact everybody throughout the state. And then on the federal side, of course, that impacts the full country. But when you think about the things that you use every day, local elected officials have that last decision and make those votes. And so definitely I need to be getting engaged. And it can be, you don't have to go to City Hall. You can most of the times hop on Zoom, because most elected officials, council meetings and work sessions are on Zoom or they're in person. And we in the city of Clarkston are still on Zoom, so you're more than welcome to chime in. And if you come to a work session, you can sign up, you can ask questions, you can comment on things that you like and do not like, because quite frankly, I'm there to serve the community. And so whatever the community is, the majority says they want, that's how I move, and that's how I vote. And so I need, more people to participate in our meetings and give me their input and feedback, so I'll make the best decisions for you.
Let me ask you this, because I read a statement from you that says my priority is what my people need and want.
Yeah.
Have you ever voted against yourself or your people?
Voted against myself.
Meaning, this is how I feel about it, but my constituents, the people I serve, feel like they need this.
For sure. It's always bigger than me, and always has and will be, right? I was elected because these constituents said she's the best voice of representation. So I take myself out of all things, even if I think it's a better choice, and I vote for the best interests of my constituents. For sure.
I had you here today because I feel that we're losing a lot of young people, that a lot of things that are going on is not representing democracy. And how do we, I have you here because I believe that you're an inspiration to young people, but that's my opinion. How do we inspire? How do you get young people and people that don't trust to come back to government, to come to these meetings, to even be interested in finding out the meetings and what they are and when they are? How do we bring them back? Because we, the people, must become the government again in order for this government to begin to work again.
Yeah, it must resonate with them, right? Honestly and truly, it needs to be about, we need to show up talking about issues that people care about, that's impeding and impacting their everyday life. And so having those conversations on what do you want out of government and what do you feel like we need to improve in, or what we're not doing correctly, needs to be had. Those are the conversations that need to be had. I think we also got to bring them along to coming to a meeting and seeing what we discuss, because if they've never been to one, why should I go? How is this gonna put more money in my pocket? How is it gonna help me feed my family? Those are the questions. Not realizing that a lot of those programs to help them feed their family are instated and discussed in those meetings. I think the other thing is too, we have to talk to them in a more comprehensive way and not in an elitist way. And sometimes as elected officials, we use terminology, we use acronyms that folks may or may not know about or understand. And so we got to connect things to issues that people care about, whether it is food or water or education or transportation, those things, and kind of correlate. And it's going to take time. We can't think that everything is going to be transactional. We have one conversation with somebody and then they're brought along. That's not true. And I hope to be an inspiration, but if I told you it was easy each and every day to show up as an elected official, I would be being very untruthful. It is all my days are not easy. Some days are truly challenging. And, you go into these spaces with all this energy and enthusiasm and, it can be drained, but you just got to remember this has nothing to do with me. This has everything to do with the folks that showed up at the ballot, that voted for you because they needed a voice. They needed somebody there that's going to speak on their behalf when they can't be present. And so I kind of channel and center that each and every day, despite the challenges that I'm facing.
That's what democracy is all about. Let me tell you, it puts my heart at rest. And, it puts my heart at rest. And without understanding it, I believe that you set yourself apart as a politician. You set yourself apart because you're what real politics is about. And at this point, I just want to say thank you very much. We appreciate you.
Thank you.
We appreciate you. But I want to talk about something that as a medical provider, that is important to me, because you have a very diverse community, and it's minorities, a very diverse group of minority people who are the biggest group, the largest group of people. Healthcare is just a disparity. It's not there for them. How can I'm old school. I came up in a day and like everything was magical then. let me laugh and say that everything was magical then. And I was born in New Orleans. My audience knows that I'm from New Orleans. And then I came here to Grady, where everybody, and I'll talk about Grady because we're here in Atlanta, and for those of New Orleans, I have great followings in both areas. That people who were sick, no matter how sick they were, they went to the hospital, they were treated until they were well. If something happened to you and you was from Missouri and something happened to you, because I was a nurse at Charity Hospital, you came into Charity, we took care of you until we can get you well enough to get back to your state. You didn't have to apply for Medicaid or Medicare or have insurance. It went according to your income if you were able to pay. When I got here, it was like the Grady card. You had a Grady card. Some people paid $40 for their medicine and some people paid a quarter. That's what I believe. Okay, but that's not our reality anymore. They took that away. So let's talk about our reality. Let's talk about healthcare. And if we could explain to people what's really going on in healthcare.
Yes, so a lot of things, right? People are not prioritizing the need for adequate, comprehensive healthcare for everybody. And quite frankly, right now in our country, we're seeing that, if you have resources and if you have capacity, then you have access to healthcare. Having access to healthcare, quite frankly, is a luxury. Me included, right? To have insurance is definitely a luxury because I have family members and friends who do not have health insurance, so they're just going from one job to the next job to improve their health benefits. And so what I'll say here is this. I know I started this conversation off saying I'm from Sandersville, Georgia, which is in a rural area. Well, my county is Washington County. There is no hospital in Washington County. So my aunt, who passed away a couple years ago, had to be transported to the next city over in Dublin, Georgia. And so that's an access issue.
How did she get there?
Well, so family members actually have access to cars and could transport her there. But I also have friends that live in the southern part of this state that also do not have hospitals and, can take an hour, 2 hours to get to, and they don't have access to transportation. And so quite frankly, what we see is a significant amount of deaths in those part of the state. And so really it's a matter of policy and finding the budgetary funds in order to ensure that everybody has access to healthcare, because that should be fundamentally like a primary priority for everybody. Because if I don't have adequate healthcare, can I go to a job and perform? No, I can't. If I don't have adequate healthcare, can I take care of my family? Likely not. And so we as elected officials, regardless of what level of government you are, we can enact and do things policy related. But quite frankly, as a local elected official, I'm leaning on the state to make a decision. I'm leaning on the federal government to provide funds for those decisions that they're making on the federal side that kind of can supplement what's also occurring in the state. But as a local elected official who does not have a hospital in her city limits, I have to work and coordinate with a lot of the community providers that are assisting with transportation, language access, translation, to ensure that people actually get the appropriate services. One of the pieces of policy that I passed initially when I first got elected at the age of 26 was that I moved on an MOU. So we had I looked at reports.
What is an MOU?
Oh, I'm sorry. See, there I go as an elected official using terms other folks may know. So MOU is a memorandum of understanding. And so basically it's an agreement between two entities or organizations or things like that. And so essentially what I did was create an MOU after reviewing reports that showed that we had an increase in domestic violence cases in our city. And so I went on a ride along with one of the officers because I felt like it was closest to the community. And what they said is, hey, we give them this pack of paper. Well, this pack of paper was in English. And I know I started this conversation saying it's up to 60 languages spoken in Clarkston. So think about who could not comprehend or understand or read the pack of paper that was given to them so that they can get out of these tumultuous situations. And so what I did was talk to a local community provider, and we worked collaboratively to address some of the domestic violence cases that we were having and adequately provide intervention and services to these individuals to get them out of those situations, but also meet their medical needs as well and make referrals, adequate referrals. Because I also know that our public safety officers did not have the skills or the training to do so. And so those are the types of things that on the local level I've done. In addition to that, working with the university, Georgia State University in particular, we have like a healthcare task force where some doctors from different hospitals around the metro Atlanta area and the university is doing research and trying to help us address some of these common issues that individuals in our vulnerable community are facing, to actually come up with solutions with, whether that means funding, whether that means collaboration and brainstorming and providing some solutions, or whether that means an asset map, right? Of saying, hey, here are the healthcare providers locally. Now, these are some referrals, or quite frankly, working with one of the other things I've done is work on the onset of COVID, right? When it was becoming a lot, there was a Clarkston COVID task force, which was great, right? So it had some nonprofit leaders, health professionals from around the city, and local government all sitting at the same table talking about and hearing from people working with individuals in our community every day to address the issues. And so we did a walk-up, drive-up COVID drive, right? And of course, I was combated with, this isn't going to work, it's going to increase the spread. That's because that was dis and misinformation, right? To be honest with you, and people just didn't know what they didn't know. And so I was trying to ensure that we knew who had it and that they could quarantine themselves so we could stop the spread. That was it. And so through a lot of discussion and collaboration, we came up with the first walk-up, drive-up in DeKalb, and we were able to assess and find out and, provide resources and then education, basic education on what you needed to do if you had contracted COVID, right? And to kind of dispel some of those myths and that dis and misinformation that people were hearing on TV and commercials and wherever else they get their news.
And the internet.
Yes, on the internet, right? And so that firsthand, being a nurse, so much untruth. So, there's so much that we can do. It does require time. I want you to know that it seems like local government moves so slow. And sometimes I feel that way too. I'm a millennial still. But, with the appropriate elected officials, and that's why you gotta vote. You gotta show up to the ballot for who you want. to move the city forward. And so, we've been able to take some thrives and leaps and bounds to adequately provide some solutions to some of the healthcare concerns that we have in our community.
It sure sounds like you can be a mentor to some of the older council people in local government. It's so tell us about the most moving law in your district that you're excited about having. That's the most moving one to me.
Yeah. So that one was definitely groundbreaking. I definitely got calls from different cities saying, how did y'all do that? Or what caused you to think of that? And that just came, I'm just trying to find a solution, honestly, to a problem that, was posed to me. I think every piece of legislation that I move on is groundbreaking. Right now, my focus is economic development. We saw, due to the pandemic, a lot of businesses closed, right? And so we also see now that we just had to authorize and approve our, and adopt our millage rate, which is, millage rate is your tax rate, right? That individual will be taxed in your city. And so we just moved on and adopted it, but we saw that we had a decrease in commercial development. Well, people don't realize this. You can have 1 million homes in your community, and that's great, right? However, they don't bring in the same tax revenue that commercial development does. And so with that, we saw a deficit in commercial tax base in our city. And so that definitely had an impact on our budget. And so my focus is, if I can fix the economic development here, then it won't be on the homeowners and independent residents that live in our city to kind of help us balance our budget, but we'll have something sustainable. And so, right now working on a ton of initiatives and a tons of pieces of legislation so we can, one, get more investment in our downtown center, because we have so many great businesses, so much diverse cuisines, so many great services that are rendered in languages to people that they don't even know about, right? And then the other thing is trying to make it a place that people want to come shop. They want to come spend time with their family. We have several parks. We want to bring people to Clarkston. And we also want to be mindful that a lot of our residents actually have to travel pretty far to get to their jobs. And so I don't want a city where you have to travel an hour or so to get to work. I want a city where you can enjoy living there, your family, you can enjoy playtime with them, but you can also enjoy working in the city. And so that is what I'm trying to get to. And so there are definitely a few pieces of legislation I'm working on right now. We just got one passed a couple of weeks ago, last month actually. It's called Empower Clarkston. And so we're trying to do workforce initiatives. And so we're trying to hire people in Clarkston to gain a skill set to help try to get these skill sets that they need to reduce some of these light bill and water bills that our individuals are seeing in their home due to like a small leak or just a bad bug. And so we're working with Pt.2, which is an organization that's helping train them, right? And then getting them the hands-on experience to addressing some of these solutions to reduce those individuals' bills, but also give them the skill sets so they can open up a business, hopefully. That's what I'm hoping for in our city, where we don't have to go out and get contractors. They're right here in the city of Clarkston. And that was definitely, I'm thankful for my colleagues for voting on that after I introduced it. But it's definitely an investment in our economy, I believe, and in our community as a whole to reduce some of those burdens, cost burdens that people are seeing in their homes, maybe leaks and things that occurred during the pandemic that they just have not been able to fix, and it's free for the residents who just have to apply, right? And put in an application to say, my light bill is too high, my water bill has went up, right? And they're gonna do some assessment, figure it out, and then a local resident who is a part of the program will be there to help and assist with some contractors through Pt.2.
I think it's awesome, and the best part about it that is we do have multiple languages, but it's put it out to everyone so they can receive it. So it's not only done, it's done, it's receivable. That's awesome.
Yeah.
It's good things. We still have so far to go in healthcare.
Oh, for sure.
Sick people are still being put out on a sidewalk, and like you were saying, it's the money issue. Is if you have good money, good insurance, you're gonna get the best care, and you might survive cancer.
Right.
If you don't have the money or the insurance,
and that's not the country.
Then you're gonna die.
Right, and that's not the country that we want to live in.
That's America. But we just need. How do we? And this is for people whose who's living in an area that don't have somebody. I think it's awesome when we can have a politician, and I want to say it like that because that's how people feel about it. A politician that may feel this way, but my people want this, and they could go in the direction of the people. My God, if we could get 50% of the politicians in this nation to go in that direction, I mean, man.
I agree with you. What I'll say is that while I'm a politician by title, I'm an everyday person, and I'm an organizer at the core and at the heart. And based off my upbringing, none of those titles matter, but I mean, it is to do the will of the people, and I will encourage anybody, if that is your passion and you want to help people, run. You don't have to have credentials. You don't have to have some type of special experience to be an elected official. You just have to have a passion and a willfulness to learn what you don't know. And I'm going to be honest with you as many times as I can. I don't know everything. I don't claim to know everything. But what I do is I put forth the effort to try to learn. And so that's what coming in this role means. And I have lots of elected officials, new elected officials, quite frankly, who, are much seniored. However, they're learning this, and they thought it was easy looking from the outside in, but they're taking the day-to-day steps that they need to read and take the trainings and get basic education. But I encourage everybody to just put your head out there, but also consult with people that are already in the role that you admire, that are doing the great work, and say, how did you get here? And how can I help you get here? And that doesn't always mean you got to be a politician. It may mean, hey, I need to join a committee. I need to get more insight on what people want. We have tons of committees in our city specifically, and we need so many people to just join them. And I get it. We need to do some assessment on that as to why people aren't joining them, and then how can we really gravitate towards them to bring them along. And it's going to take some time because, quite frankly, sometimes it's just not a priority. I make a lot of sacrifices to continue to serve. Because it's important to me, but I do understand and definitely empathize with folks that I just got so much going on, for sure. So then just come to the meetings and give your input. But if you know somebody that's great at this, that's willing to put forth the work and the effort to move the city forward and the people that they serve for and the most vulnerable, get them to run, help them run. We need those good people in office.
Well, I have to say that politics have to begin to smell sweet again. And you, like YT, can be a part of making it smell sweet again. I'm feeling really good sitting here, but I don't want to keep you. I know you're busy and you have a lot of things to do. But I saw, like I say, I'm a fan club leader. I saw you, I think it was Facebook, but I see you everywhere. And you were talking about we have great things coming up. And you were at this meeting and y'all had decided. Tell us about that. After that, I'm going to let you go. Because I can keep you here forever.
So it's great that I work in my city, right? But I am only as strong as the information that I know and lessons learned from people across the country so that I can enact those. And so one of the boards that I recently applied for and did an interview for was the Local Progress, which serves local elected officials from across the country. And I think it's one of the most fascinating organizations in this country that has been a resource for me for quite some time. But essentially, I have joined the Black Caucus. And so as a Black Caucus, it's Black elected officials, local elected officials from across the country, not just in Georgia, not just in the South, but in the Midwest and out west and in the North. And so we all come together to adopt how we're going to work together, but also talk about these issues that are impacting, our Black and brown communities across the state. And then hopefully we want to work diligently towards creating an agenda. And so people that are new elected officials that are Black and brown and feel alone sometimes on their board won't have to go at it as if I got to figure this all out by myself. We'll have a roadmap that kind of can help them, and then we'll also be there as a resource to kind of support them. And we do that now already, but this is just on a granular scale.
Well, I'm gonna say, I'm feeling stronger. I really am. I'm feeling like this conversation gives me hope. I started Vivacious Speaks because, my little first commercial said, America has reached critical mass and we've lost the power to dream. but knowing that somebody somewhere, it only takes a seed, right?
Right.
Somebody somewhere is making it better. And you are what we're all about. Thanks for helping us fight this war. I'm confident that I'm walking out with a new confidence. You know, maybe one more thing. Can we talk about this? One more thing. I promise you this is the last thing. Because I got to let her get out of here, y'all. But one more thing. Crime and murder. Is there anything, I know, the government don't have the guns. How in the world they got the guns? Why is everybody shooting everybody at the gas station? They have to have police cameras in the gas station. I saw that, comment, the people killing each other at the gas station. I don't get gas in my city. I work out, we still didn't travel. The COVID didn't end for us. I mean, it didn't end. And now it's rising instead of falling. So we'll still be contracted out of areas. So I don't work in my area.
Mm-hmm.
I don't come home in the city to get gas. I get gas where I work.
Mm-hmm.
Because, you don't know who's at that doggone gas. Is there anything, I know you can't do everything. You can't change people's hearts.
Mm-hmm.
That comes from people's hearts. But is there anything as a people or as a government we can do to help that situation?
Yeah, so if I told you it was an easy playbook to that, I'll be telling stories again. What we saw during research, though, is there was an uptick of crime, and a lot of it, quite frankly, stems to an issue that no government has ever addressed, which is poverty, right? If I can't meet my basic needs of life, then I will engage in, unforeseen behavior that's harmful to other folks. And I think one of the things that the county has done a great job of, and we worked on it as well with our local gas station, for your example, is putting more cameras in places to catch people, but also getting more officers on foot and being present at some of these locations where we know we're seeing an uptick in this activity, to kind of be there and be present so we can kind of halt off and know there will be no fatalities. But to be honest with you, we have to start addressing poverty. We have to start addressing healthcare issues that we talked about today. We have to start addressing the issues that are impeding on people to meet their everyday life needs, because a lot of that is resulting, quite frankly, in this horrendous behavior and deaths in certain cases. And you also got to address the issue that people don't want to talk about, or just, due to the pandemic, they saw an uptick in is mental health. Yes. People have mental health issues that are untreated. They're not receiving adequate intervention. To your point, they don't even have insurance. And that healthcare is here. Mental health, access to it is here, as far as who gets covered for it and who doesn't, and the stigma associated with it. We have to start at the ground level, understanding everybody has mental health issues. Let me tell you this example. You get sad, you have a mental health issue. It doesn't mean that you are exhibiting these bizarre behaviors and having a psychotic break. It means that I'm going through everyday life changes, and at this point I don't have a solution to it, and this is my response to it. But through therapy, through medication intervention, if you need it, then guess what? You'll be able to adequately process and deal with some of those issues that will result in you not engaging in some of this deviant and harmful behavior that's just causing senseless deaths, if you ask me.
And I want to say this, as a mental health professional, that we're seeing such an exacerbation. And if you're going through changes, see your doctor. Mm-hmm. It's okay. You may need a medication adjustment. Mm-hmm. Don't be ashamed. That's the biggest thing in our communities, especially in your area. Because for so long we've been taught, we say crazy. Crazy to me has become funny. But mental health issues, like you said, we all have them. And that's what I tell all my patients. We each dealing with something. We both dealing with something here. And you can help me like I can help you. And we can help one another. Girl, I shouldn't say girl. I don't want to go there. But girl, you have been a blessing to us.
Thank you.
Is there anything you want to say before we...
Yeah, just thank you for having me. If I can ever help anybody, despite you living in my jurisdiction or not, just please reach out to me and follow me on Facebook Instagram, all those things, and tell me what I'm doing well, tell me what I'm not doing so well, tell me what I need to do better. I'm always there to improve. So thank you for having me, man.
Thank you.
Yeah.
Look. Thank you. I really want to hug, but thank you so much.
Yeah.